I'm from ProEmTech Infosystems Private Limited. We started in 2011 as a company dedicated for the medical software and medical hardware.
Okay.
So we initially started with 3 members, and now we grown to 35 members. And we started developing hospital management system, which is a complete solution for the hospitals, from the software till hardware. For example, there are specific areas in the hospitals which are not connected or interconnected. So we developed this software considering the interoperability between these devices. So we've selected the HL7 protocol, so that can be used to communicate between the softwares. Then what we have done is we have developed few hardwares which can be used to integrate it with the software. So we have one of the hardware is the nurse's call system, which can be used to patient to notify the nurse that there is an emergency. And with this our integrated system that is built using the IoT concepts. So with this we can able to track how much time required for a nurse to give a service to a patient who is in needy. And there is another thing like the software is intelligent enough to find out which nurse is available at a particular point of time. So this is what we are doing through our and they can even use it for the reviewing, like okay, how many nurses are required for the hospital at a particular point of time, what is the load of a nurse. Usually nurses are overloaded most of the cases. So with this we can able to clearly identify how many resources are required for the hospital. Second thing is we have Android based queue management system. This is again work based on our hospital management system as a base, and this is work on top of that. If you have a TV which supports Android and using an Android dongle, you can convert the TV to a queue management system.
Okay, and then you can use it.
So at a time this system can display 5 doctors' details. So this information it can give, and it is a unique feature which is not there with anyone. And our application, the hospital management system, works in a hybrid model. Few of the informations which is required online, that is available online. For example, not all the informations like the day-to-day billing is not required online, because in India also there is a lot of problem with the connectivity, and we are serving some Nigerian customers. The problem is the connectivity is a big issue. So what we did is our core software will work without internet, and what is required to be available online, that we are providing online. So we have an application called MI Repo. It's very secured, it's having end-to-end encryption. So once the patient, it's like an e-prescription, then online appointments they can take, their lab reports, it's available online, and they can even communicate with the doctors for asking some doubts, the prescriptions, then their discharge summary, bills, everything will be available online. Which is required for the patient, it will be available. Dependency on internet will be reduced for the organization. So we mainly consider like, okay, in our current environment what is required, because we don't have 100 Mbps bandwidth everywhere throughout India. So we made this software in such a way that it can be implemented even in a remote area, and we have a very small software which can work in a small pen drive.
Okay.
That is called Doctor Assist for the clinics, so a single doctor clinics. So advantage of that is no need to do a cumbersome installation, no need internet. They can just plug in a pen drive, start using the application, so that they can use it for prescription, appointments, all these things. So for our clients, the hospitals, they said that okay, they have informed me about this
confidence.
And my main intention is to know what is required for this industry. So with this, while interacting with the people, we will come to know what exactly they are looking. So as a software professionals, we can give them a solution. That solution is this software. Really, I have attended few presentation. I've seen one HR have presented a case study. It was one of the beautiful one. I'm in this industry, like I'm an automotive software professional, and I am in this industry for 12 years. But and I see their presentation, it is very nice one. Like it is in detail. They went in depth and collecting the information. I think their professors helped them a lot. I think Apollo Group have helped them a lot to get this kind of information. And the beautiful presentation. That 10, I have seen 3. All 3 are beautiful. Interacting with the people, get to know what exactly industry needs, so that I can go back and implement it and again give it as a solution. This integrated nurses call system is actually a case study for us. We have found out that there is a problem in a hospital because their nurses call system is not satisfying the need. So then we developed this. It took almost 1.5 months for us to come up with a prototype. But we got an idea from a problem of our customer. So our duty is to find out what they want. It's not like a conventional hospital management system and get the software and get the money and go. It's not like that. We are trying to understand what exactly they need and what exactly problems what they are facing. Address it. That's all.